Hi friends, welcome to my first video. In this first video, I would like to talk about how I was diagnosed with non-Hodgkin's lymphoma. So December 2015, I felt a few lumps in the chest area. And so I went for a mammogram, and in the mammogram, what they found is a couple of cysts, but they also found some enlarged lymph nodes during the mammogram. So when I met with the oncologist that deals with women's cancers, particularly breast cancers, she said that while it doesn't look like there's any concern, she wants to do further testing on the enlarged lymph nodes. And as a result, I was sent to specialists who would do a series of different biopsies of the actual lymph nodes. My test started in December 2015, and the first test that they did is called the FNA, which is a fine needle aspiration. And what they do is they basically take a very thin needle into the lymph node and they drain out some fluid, and then the pathologist studies that fluid. And during the FNA itself, they had a pathologist in the room, and she did some preliminary analysis of it and immediately said that this does not look like a malignant breast cancer. However, she recommended that more testing, or the final report we had to wait for in order for them to really determine what this was. So when the final report came, they agreed with her initial assessment that it was not a malignant breast cancer, and then I was recommended to do further biopsies. The next biopsy that I had is the excisional biopsy, and in that biopsy they pretty much slice a piece of your lymph node and they take out the actual piece of the lymph node, and the pathologist studies the actual gland that is enlarged. And that's what they did. So it's not quite a surgery, but it's a little bit more serious than a fine needle aspiration. And they numb the area and they basically do a very thin slice, and then the pathologist studies it. In this case, there was no immediate feedback provided by the pathologist. I had to wait a week to get the results. So after doing the excisional biopsy and waiting a full week to get the results, I was given a call by a doctor, and he said that he was going to a conference and he was flying out, but he wanted to let me know that the diagnosis was that I had lymphoma. And he told me this on the phone and then said, well, I'm going to a conference, and when I get back from the conference, we can talk and have an appointment and I can discuss it with you. And then he just hung up the phone. Obviously, I had been completely speechless when he was telling me. I had not prepared for any questions, and since it wasn't an in-person meeting, I didn't have a chance to ask anything. And I was just left holding the phone with this diagnosis and just didn't know what to do at that point. So after that, I started to research and Google and find out a little bit more about lymphoma. A little bit I had started to research because, as I said, they were already in my scripts. They were saying things like suspicious for lymphoma. So I started to look it up, but now it was a bit more serious and it was real. And it was actually quite surreal because, until you're actually told that, you never quite think that it's happening to you. So when I researched it, I found that it was a type of blood cancer, and it's a cancer of lymph nodes, and really it circulates through the lymph nodes. I then realized that this was actually quite serious, and I needed to take this positively, but it was serious enough that I needed to find a doctor that I was comfortable with. And the doctor that told me on the phone and then had to go to a conference was not the right doctor.